is that of the liver parenchyma, in which you are seeing that the outer surface of the liver is irregular. There is coarseness and the vessel margins are blurred. This is the right lobe of the liver, and see the GB wall. So this is the right lobe of the liver. This is the gallbladder with a calculus within it, and compare it with the right kidney parenchyma if you want to. But however, you will see the irregular outer surface, coarseness, increased echogenicity, that of the right lobe of the liver, and this is the left lobe of the liver in longitudinal section, showing you irregular outer surface as well as coarseness, blurred margins, that of the vessels. This is a cirrhotic liver, and you can see that the difference between what is the difference between the normal and this one, this segment. In this segment, the two main findings that we are seeing is the irregular outer surface, that of the liver, then as well as not only the diffuse increased echogenicity of the liver parenchyma, rather coarseness of the liver parenchyma as well, with blurred vessel margins. This is the left lobe in longitudinal section. So this is a cirrhotic liver. Thank you very much. This is a transverse section of the liver and that of the left lobe of the liver, regarding the parenchymal study, that of the liver. Now you see that the liver shows diffuse increased parenchymal echogenicity with coarseness all over. Coarse texture is seen. Now remember one thing, that in majority of, not all, but in majority of the cases of cirrhotic liver, this is a cirrhotic liver, because you see that the outer surface is irregular, the texture is coarse, and this is the left lobe of the liver in transverse section. This is the ligamentum venosum, this is the IVC, this is the caudate lobe of the liver, or the segment 1 of the liver. Remember that the echogenicity of the caudate lobe is usually preserved in cirrhotic livers because the caudate lobe has its own separate blood supply. Now you can see that this is a cirrhotic liver. This is the segment 1 of the caudate lobe, and this is the cirrhotic liver. You can also see that there is difference in echogenicity, echo brightness, echo texture. You are seeing coarseness as well. See that the outer surface is irregular. And that the liver is seen below costal margin. Here, I am just below the costal margin at lower end, and you just see now see the wall of the gallbladder. The gallbladder in itself is normal. Gallbladder is normal. The wall appearing thick and more bright is because of adjacent liver parenchymal changes. In longitudinal section, this is the left lobe of the liver. Again, you will see that this is the caudate lobe of the liver, segment 1, showing relatively decreased parenchymal echogenicity or preserved echogenicity. However, that of the left lobe in longitudinal section, the echogenicity is not only raised but it is coarse as well. This is the outer surface, irregular. This is the IVC, this is the portal vein, and this is the ligamentum venosum. So the caudate lobe echogenicity is really preserved in most of the cases of cirrhosis. This cirrhosis, in this particular case, the liver is seen below costal margin. Its echogenicity is raised. This is the portal vein, and you will see that the hepatic veins will show significant degree of blurriness of their margins. Here you see that this is the middle hepatic vein. Note the degree of blurriness. See the coarseness of the liver parenchyma. So this is this is a case of cirrhotic liver, and here you can see that the liver has rounded angles, and the left lobe exceeds the origin of superior mesenteric artery from the aorta. This is the superior mesenteric artery arising from the aorta, and you see that the liver is exceeding the origin of superior mesenteric artery from the aorta. This is the liver. This is a case of cirrhosis of the liver. Both lobes are enlarged. Left lobe is enlarged more as compared to the right lobe of the liver. Thank you. This is the study of liver parenchyma, that is showing you irregular outer surface. In this view, with diffuse increased parenchymal echogenicity, coarseness throughout, blurred vessel margins, rather a bit tortuous as well. This is the middle hepatic vein and the irregularity of the outer surface. So this is an advanced stage cirrhotic liver. Note the degree of coarseness throughout the liver parenchyma. See the GB wall and the portal vein. This is the GB wall appearing irregular and thick because of adjacent diffuse liver parenchymal disease. Irregular outer surface, coarseness, portal vein is not dilated and is patent. And this is the left lobe. And in this case, you will see that the irregularity of the surface, outer surface, the degree of coarseness, and the point here to show you is that this is the ligamentum venosum, as this is the left lobe of the liver in longitudinal section. This is the ligamentum venosum, wavy shape. This is the caudate lobe of the liver. This is the inferior vena cava. And you see that the echogenicity of the, if we compare the echogenicity of the caudate lobe, this is the caudate lobe or segment 1 of the liver, they are almost the same. Whereas in most of the cases, in 90% of the cases, you will see that the echogenicity of the caudate lobe or segment 1 will be preserved, because this segment of the liver contains its own separate blood supply. So in this case, we see that the caudate lobe is also involved in the cirrhotic process. So this is an advanced stage cirrhotic liver with portal vein measuring at the level of porta hepatis from inner to inner about 10.2 millimeters, normal is up to 13. See the degree of irregularity of the outer surface. This is the outer surface of the liver, this area. See the irregularity of the outer surface throughout the liver currently. All of the liver shows the same. लंबा सा है कि सारों रुको साकिट के साथ बाहर निकल. This is the middle hepatic vein. See its margins. बेटा लंबा सा है कि सारों. So this is the study of advanced stage liver cirrhosis. This is the gallbladder normal. Thank you. On the right side of your image is another cirrhotic liver, but this is not an advanced stage. You can see the irregularity of the outer margin. You can see the irregularity of the outer margin. This is the outer margin of the liver. See the coarseness and compare between the two segments in front of you. This is also a cirrhotic liver with coarse echogenicity. This is ligamentum venosum. This is caudate lobe. And compare this cirrhotic liver with that of this cirrhotic liver. Both are cirrhotic, and note the difference between the echogenicity and texture of both. This is the left hepatic vein, and note the degree of blurriness of its margins. Again, you see the irregularity of the outer surface. Now, another thing is that in this case, we see one thing opposite to that of the study we performed in this case, and that is that the caudate lobe has this is the ligamentum venosum, IVC, the caudate lobe, and the echogenicity of the caudate lobe is preserved, and you can see a tiny tubular structure which is the vessel within this caudate lobe, and note the degree of echogenicity and the ecotexture of this liver and that of this liver. So this is a more advanced stage of cirrhosis. This is an early cirrhosis. This is a case of early cirrhotic liver parenchymal changes. Thank you. Is that of the liver parenchyma, in which you are seeing that the outer surface of the liver is irregular. There is coarseness and the vessel margins are blurred. This is the right lobe of the liver, and see the GB wall. So this is the right lobe of the liver. This is the gallbladder with a calculus within it, and compare it with the right kidney parenchyma if you want to, but however you will see the irregular outer surface, coarseness, increased echogenicity, that of the right lobe of the liver, and this is the left lobe of the liver in longitudinal section, showing you irregular outer surface as well as coarseness, blurred margins, that of the vessels. This is a cirrhotic liver, and you can see that the difference between what is the difference between the normal and this one, this segment. In this segment, the two main findings that we are seeing is the irregular outer surface, that of the liver, then as well as not only the diffuse increased liquogenicity of the liver parenchyma, rather coarseness of the liver parenchyma as well, with blurred vessel margins. This is the left lobe in longitudinal section. So this is a cirrhotic liver. Thank you very much.